Welcome back to the Morning Blend, where we are transforming your health with Wheaton Franciscan Healthcare, which is part of Ascension. Heart disease kills more women than breast cancer, and there are many risk factors that can affect, or have an effect rather, on a woman's heart health.
Yeah, the good news is that heart disease can be controlled and sometimes completely prevented altogether. Here to change the way you think about women's heart health is Dr. Desiree Dizadji, there we go, from Ascension Wisconsin All Saints in Racine. Good to have you here.
Good morning.
Great
Thank
to
you.
see you.
Thanks for joining us, Desiree. Let's talk a little bit about some risk factors, especially when it comes to women's heart health. This is really important for women to know and understand.
I think when we look at risk factors for heart disease, there's the ones that we can't change. That would be our age and our family history. But there's a lot we can control. So the good news is there are things we can do about high blood pressure, high cholesterol, cigarette smoking, diabetes, inactivity, and all of those things we can take charge on early and hopefully modify our risk of getting heart disease later.
And there are some early warning signs, too, that women really need to be aware of that are indicators that there might be an issue, right?
It's important to know, too, that women often present less classically than men. So men, will think of as often having that crushing chest pain, typical signs of a heart attack. Women often present a little differently, so it's not uncommon for women to present with shortness of breath, nausea, jaw pain, sometimes even back pain, or sometimes just generalized fatigue.
And those are all related to heart health potentially.
They could be.
Interesting, because I think those are nondescript that someone would not necessarily associate with that. So what kinds of questions should we be talking to our primary doctor about as females?
First of all, it's important to see our primary care physicians regularly. It's important to get the routine screening that we all need, whether it be our cholesterol, diabetes check, blood pressure check, calculating our BMI, looking at whether our weight is healthy, talking about exercise. But it's also important to let them know any particular symptom that is of concern or of a change to you, so they can take it further with testing if needed.
Well, I always think, with the primary, getting those tests and even a baseline, so each year when you get them again, you really know how your own body is changing. Because a lot of people think, well, I feel fine, I know I'm healthy, why do I need to do them? But sometimes it's just having those numbers for comparison.
Right. And I think
in further years.
The women at most risk are the ones I think that are most likely to neglect to do those things. We have middle-aged women, our risk of heart disease goes up. At menopause, these are the women that are taking care of elderly parents, taking care of their own children, and probably least likely to seek out the attention of their primary care providers.
And you just mentioned age and menopause in particular. Does the actual change in a woman's body have some correlation to a risk for heart disease?
Definitely. The risk of heart disease goes up dramatically in women after they hit menopause and in their later years. It used to be that we thought that simply replacing the estrogen that we lose during menopause would be enough to combat that, but we realized that that's not the case. Simply doing that doesn't decrease our risk, but getting to those risk factors is what will really make the difference.
What's the difference between men and women when it comes to diagnosis and treatment?
Oftentimes it's the presentation. Again, since women often present less typically than men, I think sometimes it takes them longer to get to a diagnosis, and I think because in younger years, women are less likely to have heart disease. I think sometimes it's poorly recognized by the people they're reporting their symptoms to. So again, if there is a concerning symptom, it's important to be your own advocate and make sure people know about this.
Oh, excuse me. Sorry about that.
God bless you.
And in terms of trends, I'm interested in this, what you're seeing with women as it relates to heart disease and maybe reasons for us to take it more seriously.
The trends are definitely that as we hit menopause, that risk of heart disease goes up. The good news is, though, that with our advanced care, morbidity and mortality from heart disease continue to improve. There's a lot out there that can be done, so that's why it's very important that you let your doctor know what's happening.
But yo-yo dieting and fad diet plans, sedentary lifestyles, those all can be
for sure. Looking at those risk factors, definitely trends in our society are there to increase our risk right now. Again, so many people eating fast food, so many people not exercising, so many people trying to catch that work-life balance and find time for themselves to pay attention to their own heart health and their own overall health. It makes it difficult, but it's important to do it while we can, so that an ounce of prevention is worth a pound of cure. If we catch it early and prevent it, we'll do better in the long run.
And stress obviously can play a huge part in that as well. And in illness or medications that people are taking, chronic conditions, all of those can really affect a woman's health. Heart health.
Stress can definitely affect a woman's health. There's even something called stress-induced cardiomyopathy. When people are faced with a profound,
I know
deep
people
stress,
have had that.
Right. right? That their heart can actually become weak. And so it's important to do what we can to manage the stress in our lives.
And quickly, because we're running out of time, exercise and diet clearly have a direct link, right?
For sure. And there's you could go online and find 100 different diets of the day. In general, eat less, eat right, do more, be more active. Everything in moderation. I think rules to live by.
Yeah, for sure.
So.
Helpful and easy, really.
Yeah, thank you so much for
Thank you.
being
Thank
here.
you
And
for
people
having me.
can get more information, select a Wheaton healthcare physician or specialist if they visit this website. It's on your screen right now. It's mywheaton.org/find a doctor. Nice job and great to meet you.
Yeah,
Thank you so
Thanks for
much.
having me.